Hello, everyone. My name is Jacob Otto, the host of Maes Medical Minute. We're back here with Dr. Maes. How are you doing today?
Fantastic. Thanks for having me, Jacob.
Yeah, so I wanted to get together again and have a quick little conversation about what's going on over at Health Guardian Imaging. You want to start by kind of explaining what kind of machines are over there?
Sure. So, Health Guardian Imaging is a full service imaging center. We offer all the same modalities and machines that you can utilize at a hospital setting, but we have them in an outpatient imaging center. So you can get an MRI, a CT, an ultrasound. We have X-ray. We have DEXA. Really, we're able to image any part of the body you need and perform any kind of test that a patient might need.
Okay. Is there any difference in like the quality between going to a hospital and coming over to Health Guardian Imaging?
There's the difference in the quality is it doesn't exist. It's the same quality machines. In fact, most of our machines are new, and the hospitals, they probably bought theirs 8, 10, 20 years ago. So a lot of hospitals keep their machines pretty much indefinitely, but our machines are all brand new. So the only thing you get differently at Health Guardian Imaging is you don't have to wait for weeks to get in, and you don't have to pay near the same price. Our prices are a lot more reasonable. You don't pay the inflated hospital prices. So, for instance, for an MRI, we charge $600. For a CT, it's $400. For ultrasound, it's $160, and then X-ray is about $100.
It makes it super affordable, it sounds like. Outside of that, we talked a lot last time about maybe preventative healthcare. Is there anything like maybe with an MRI machine or a CT we can do for preventative healthcare?
Absolutely. Um, Before I answer that question, I just wanted to talk about some of the changes that have really happened in healthcare
Yeah,
over
absolutely.
the last 20 to 30 years. It used to be that a patient would come to their doctor with clinical symptoms, whether it's a headache, change in their stool pattern, fevers, things like that. They would come to their doctor with symptoms, and the doctor would do a bunch of different tests and try and figure out what they had. Medicine has come so much further than that in the last 20
Okay.
to 30 years. So now we don't really have to wait till the patient is sick. And that's part of what we're doing at Health Guardian and Health Hub Clinic is we're trying to screen our patients before they even get sick. So we're trying to find the disease before it even becomes symptomatic for the patient. So we all have heard about people with breast cancer. So we all have family members with breast cancer. It's kind of the same concept. If we find that breast cancer when it's really small, when it's what we call a microcalcification in the breast, it's a lot more treatable than if we wait till it's a huge mass that's gone everywhere. And so healthcare and medicine in general has really changed in that regards that we're not just trying to diagnose patients after they're symptomatic. We're trying to diagnose disease before it even happens and identify which people need to be following their findings a little bit closer than others. So that's really how medicine has kind of changed, and we're at the forefront of doing that.
Would you describe that? Sorry to interrupt, but would you describe that more as a proactive instead of a reactive approach?
Yeah, absolutely, you've nailed
Okay.
it. We want to be as proactive as possible. We want to catch it when it's still treatable. We want to catch it when it's easily treatable. We don't want you coming in and saying, "Hey, I have colon cancer and it's gone to my liver and it's all over my body." And at that point, you're just fighting for your life.
Right.
The cure may not even be a possibility anymore. And so we really want to get away from that kind of treatment for patients. We want to catch it when we can do something.
Okay.
And so that's not always easy to do, but with all the different diagnostic tools we have now and the labs that we have, we can certainly make a good effort to find all those diseases and prevent as much as we can.
So that's what we're talking about with preventive healthcare, not necessarily preventing it, but being proactive against it.
Absolutely.
Okay.
Yep. And you'd asked about MRI specifically. So with the MRI, it doesn't have any radiation, so there's no risk to the patient in terms of radiation. Even if we did a CT, the dose that we're using is really quite small. But with the MRI in particular, there's no radiation dose, and it's really good at looking at soft tissues. And so, one of the best uses for an MRI is looking at the blood vessels in your brain. We all know somebody that had an aneurysm, or we have family histories of aneurysm, and we want to know, is this an aneurysm or is this just a normal headache? And so getting that brain MRI and looking to see if you have an aneurysm is really important. Because if you're a patient that does have an aneurysm and you get a headache, you need to take that headache a lot more seriously
Right.
than a patient that has no aneurysms in their brain and they get a headache. It doesn't necessarily mean it's going to be an aneurysm. And so It's really important to be able to screen for that. MRI is also really good at screening the abdominal organs, so it's good at looking at soft tissues. It doesn't really look at our bowel, our large bowel and our small bowel very well, but it does look at our liver, our pancreas, our kidneys, our spleen, all those things. It's really good at looking at and screening. And then, MRI is still good for all the normal diagnostic things, looking at shoulders and knees and ankles and wrists and backs and spines and brains. It'll do all that stuff as well. But in terms of preventative medicine, we're looking at a brain MRI, a circle of Willis MRI, which is the blood vessels in your brain, and then an abdomen MRI.
Awesome. So we hear a lot about the radiation. You kind of mentioned an MRI doesn't have any. Is there any other screenings we can do without radiation?
So other screenings that we can do that have no radiation would be ultrasound. That's the most common. We're looking at the large vessels in the abdomen again. So we're looking at the aorta. So we're looking at the abdominal aorta, making sure there's not an aneurysm. So we know that if a patient has an aorta that's bigger than 3.5 centimeters in size, they're starting to get at risk for a ruptured aneurysm. So at 3.5 centimeters, we're going to follow them. But as it gets closer to 4 to 5, the risk of rupture increases every year. And so, again, we want to know if someone has an aneurysm, because if they do, ideally we treat it before the aneurysm ruptures. So those are the patients that are going to be a great candidate for putting a stent in their aorta, and then that will prevent them from having a ruptured aneurysm in their aorta. Just like the ultrasound machine can look at your aorta, it can also look at the arteries in your legs. And so it'll look for a narrowing in the arteries of your legs that can be treated. So just like we have a stroke means that the blood supply is cut off to the brain, or a heart attack is the blood supply is cut off to the heart. Mm-hmm. But you can also have the blood supply cut off to your legs. And that's a lot of the reason that people have chronic leg and back pain. They always attribute all the pain to their back, but it also might be caused by narrowing of the arteries to their legs. So it's kind of like getting chest pain when you're not getting enough blood flow to your heart. Now you're getting leg pain because you're not getting enough blood flow to your legs. So that's another thing that the arterial ultrasound can do, is it looks at all the arteries in your legs.
Well, that's awesome. We talked a little bit about heart stuff last time we were on the podcast. Can you explain to me how a CT scan can help prevent maybe some heart issues as well?
Yeah. So the CT scan that we use is a low dose chest CT to look for screening for cancer. And we can also do a low dose cardiac calcium score, looking at the heart specifically. So a typical CT is fairly low dose anyway, with the contrast with the radiation that's involved in it. But we do things with the machine that we can alter some of the parameters to make the radiation dose even less. And so with the cancer screening test, we recommend that be done every single year in someone that's been a smoker. For instance, if they're a smoker currently or previously were a heavy smoker, they should be having that chest CT done every single year, because it's screening for lung cancer. Again, we want to catch the lung cancer when it's 8 millimeters in size, not when it's a mass. And so we got to be really careful with that. I had one the other day. I was reading a chest CT. The guy had a chest CT about 4 years prior to the one I was looking at. 4 years prior, lungs were totally clear, totally normal. And then on the current chest CT I was reading, there was a mass as big as my fist in his chest. At that point, it's going to be game over. There's not a whole lot we can do once it's that big and it's gone everywhere. It had gone to his lymph nodes and all these other things. And so if we do the low dose chest CT every year, we catch that nodule when it first shows up. It's 8 millimeters in size, and we can treat it that way. And then in regards to the cardiac scan for the heart, we do what's called a calcium score. And the calcium score is really going to give us an assessment of our risk for developing heart disease, for developing narrowing of the vessels that supply our heart. So again, just like with the stroke, it's a occlusion of a blood vessel that goes to your brain. A heart attack is occlusion of the blood vessels that actually flow back and give the heart blood flow itself. And so this calcium score is looking at those little small vessels that provide blood flow to the heart. And so by doing that, we know exactly what your risk is of developing heart disease. So if you have a calcium score of 0, you're doing pretty well, especially as you become 40, 50 years old. If you have a calcium score of 0, that's great. But if you have a calcium score of 100 or 200, and we can see which vessels even involved, then you may want to see a cardiologist and have them take a better, closer look at it.
Is that like almost able to predict that widowmaker heart attack everybody talks about?
Yes, absolutely. Um, the worst thing about the Widowmaker is it's something that nobody knew about, and someone just drops over dead, and that's why it's called the Widowmaker. But it's a occlusion, or a blockage of one of the arteries that supplies the blood flow to our heart. And if we knew it was there, we could have treated it. The cardiologist can do angioplasty where they insert they blow up a little balloon and it widens the vessel. They can put a stent in there if they have to. There's lots of things they can do. Even so far as if they had to, they could do a bypass surgery to bypass the blockage altogether. But if you don't know that it exists, obviously there's not much you can do to prevent it if you don't know about it.
So the ultrasound, the MRI, the CT, they're really good at preventive healthcare, being more proactive than reactive. You also mentioned you had a X-ray and a DEXA scan. You want to talk about those a little bit? Explain kind of what you do with those.
Absolutely. So the DEXA scan is really good for looking at bone density, and that's what we typically think of a DEXA scan as doing. Is it looks at the bone density, so it's going to assess your risk for fracture. And so that's typically been used in elderly patients, and we're looking to see, at what point are they becoming osteopenic versus osteoporotic. So they have a little bit of increased fracture risk with osteopenia, but when they become osteoporotic, then they have a much higher risk of fracture. And so they can start getting fractures from doing normal activities. So it's not even that they have to fall to break their hip. They could be doing normal activities and they get rib fractures and pelvic fractures and hip fractures. So it's important to know the bone density. But we have a special machine that will not only tell us that, but it will also tell us the muscle mass and the fat composition in your body. So now, as we age, our goal is we want to all kind of lose a little bit of weight as we get older, or maybe we want to get back in shape and we're trying to lose weight. Well, that's very beneficial for our health in general, but we want to make sure that we're losing the right part. So if we're losing weight and you lose 20 pounds of muscle mass, that's certainly not great for you. But if you lose 20 pounds of fat, that's fantastic. And so it allows us to know exactly what body part, what body composition is getting reduced when we lose weight. And the other thing is we found that where you carry your fat is just as important as having, the obesity in general. So for importance, for example, like people that carry their fat in their legs, in their chest, around their trunk, around their arms, they're overweight and they have the risk factors that go with obesity, but it doesn't necessarily increase their risk of heart disease. Whereas people that are carrying the fat in their abdomen around their organs, those are the people that really have an increased chance of heart disease. And so this DEXA scan will tell you percentage of fat, percentage of muscle, and it'll give you a map to show you exactly where your fat is, and it can quantify the fat that's in your abdomen, so then you can get another, a risk calculation for developing heart disease based on where your fat is located.
Outside of the health, that sounds like something maybe like a bodybuilder or a marathon runner would want to know as well. Is that something it can be used for?
Yeah, you hit it on the head. Athletes, especially as they're trying to, if you're an athlete and you're trying to gain muscle mass, this is a great tool to know exactly how much muscle mass you're gaining. I think a lot of people focus on percentage of body fat, which is that's something else we can tell you on that same test. But knowing just your percentage of body fat is only part of the story. You want to know how much muscle mass I have. Am I increasing my muscle mass? Am I increasing my muscle mass at a safe pace? We don't want to gain muscle too fast. We don't want to lose fat too fast. So we want to make sure that we're doing this in a safe way. And it really helps you, kind of tailor your diet to what you're doing in terms of either trying to lose weight or gain weight.
Yeah, I mean, I know a lot of runners and stuff kind of target certain areas of stuff like that. Is there a VO2 mask I've heard about? Is that something you guys are offering as well?
Yeah, so we have something that is called the Health Hub VO2 Metabolic Analyzer. And what this is it's a mask that you wear while you do light activity, and it will basically analyze your metabolism. So it could tell you how much oxygen you're using, it can tell you how many calories you're burning, it could tell you, what kind of diet you're going to need to be on to lose weight effectively, what kind of diet you would need to be on to gain weight effectively. And it even goes so far as to tell you like the macronutrients that you need to be taking in. So a lot of people are trying to lose weight, and we're all told, okay, A normal adult eats about 2,000 calories. So if you cut down below 2,000 calories, in theory, you should lose weight. But we don't really know your metabolism without the metabolic analyzer. And so this metabolic analyzer may say, hey, you're actually going to have to eat 1,500 calories a day if you want to lose weight. Or likewise, if you're trying to gain weight, you may be somebody that's really thin and you're like, I eat as much as I can, but I still can't gain any weight. If we do the metabolic analyzer on you and your daily metabolism is 3,000 calories a day, then you're going to have to eat above 3,000 calories every single day just to gain weight. And so it's a very useful tool to understand what your metabolism actually is.
That sounds fantastic, and something you could really pair with like the DEXA scan for those athletes and stuff, or
Absolutely.
anybody
Yeah.
to
Yeah,
really
it's a
just boost
fantastic tool to be
performance.
used.
We talked earlier about MRIs and CT scans and stuff. Is that something anybody can just walk off the street and get?
Yeah. So if you have an order from your doctor, you certainly can have your doctor send the order to us. We can call your doctor and get the order, and you can come over to Health Guardian and we'll get you scheduled and get you in and get you imaged pretty quickly. We try to get everybody in either the same or next day, depending on our availability. But that's the easiest way to do it. If you don't have any kind of doctor that you see on a regular basis, or you don't have a prescription for the imaging, the order for the imaging, you can see our partner next door that we work very closely with called Health Hub Clinic. They can see you, determine if you need to have the imaging performed, and then they can order and recommend the right one for you. They can follow up with you, or if you want to go back and follow up with your regular doctor, that's okay as well.
So get the imaging done. If you have the order, it's as easy as just coming in, providing the order, getting it done. If not, Health Hub can get it for you after the scan. What happens?
Then after you get the scan done, it'll get read the same day. So you'll have the results right away. So you can actually get your report. If you want to, we have something really special where you can actually meet with the radiologist that read the exam. So it's a little bit extra fee, but you actually get to have the radiologist go over the findings with you. And so it's really important. We may know, hey, I have a lung nodule somewhere in my chest, but you don't really know where it's at. And so you go from doctor to doctor, and it's just like, oh yeah, I had a lung nodule one time. And you don't really know if we're even looking at the same nodule over time. But by doing this, you meet with the radiologist. They can show you exactly where the nodule is, exactly what part of your lung it is. They can tell you, what your risk is based on the size and the characteristics that it has. And then when you follow up with your regular doctor, you're a lot more informed. We make very specific recommendations in radiology about how to follow up any kind of finding. And sometimes, unfortunately, clinicians they may not understand the guidelines that we're giving them, or they may choose not to follow it. And the guidelines that we give is really based on a lot of foundational evidence-based medicine. And so our guidelines are pretty good. And it's important that the patients follow those. So if you go to your doctor and your doctor says, oh yeah, we're not going to worry about that, we'll follow it up in 6 months, but you spoke to the radiologist and said, no, the treatment here really needs to be this study to prove whether or not it's a benign or malignant nodule, so a cancerous or a non-cancerous nodule, then you have that information with you before you even go see your clinician. So then your clinician is just kind of guiding your pathway, but not making you go down the wrong path. And that's really what we want to try and avoid here. We want to make sure that we're getting everybody on the right path to health. And by doing the screening tests, we're really able to do that.
It's almost just like a second opinion, then, kind of.
Absolutely, yeah.
So your website mentions something I really want to get out and let everybody know about, and that's the screenings for athletes.
Yeah.
Can you kind of explain what that is and what it's kind of for?
Sure. So one of my best friends that really kind of started me on this health screening journey for myself was Robbie Anders. He had a heart defect where the septum, so the separation between the different sides of the heart, was getting too thick. So the muscle between there gets thickened, and eventually it obstructs the blood flow out of the heart, and it kills you. And this is what is common, and you see high-level athletes that just kind of drop over dead. That's usually what they had. So he was 43 years old when he died. He was in perfect health. He had been a professional basketball player. He worked out every single day. He was a pillar of health, and you would never expect it, and he just suddenly died. And so this is something we can screen for. So when we do the ultrasound of the heart, we're not looking at all of the different factors that go along with the heart when you get an echocardiogram. That's something that's a little bit different when you get older, but what we can do is look at the septum of the heart and look at the thickness. And so we can measure the thickness of the septum in the heart using an ultrasound machine, and we can tell you if you're at risk for having this. And I know with Rob's family in particular, his sister had died several years before. There really nobody really knew what she died from. Some people thought she died from pneumonia. She got sick, but she died at home, and she was fairly young. Looking back on it, that's more than likely what happened to her. And when we tested Rob's family, his brother also had it, so we were able to, he was able to get treatment that he needed before actually getting to a situation where it could be fatal for him. So you can take medications, and worst case scenario, they could even do surgery to correct that for you. But it's really a shame that we haven't screened all of our athletes for that. We have athletes playing at all levels, whether it's collegiate or professional, and this test is so simple and so cheap to do. And so that's something that we offer at Health Guardian for all of our athletes in the area. You come in, it's a free exam. We don't charge you anything for the exam, but you can come in and get screened for this. And all we ask is you bring a parent with you, so that way if we have to give you, results that you may have something, you have a parent with you. And then if you want to make a donation to the Robbie Anders Foundation, you can, but you don't have to. Again, we're offering it free from the Health Guardian side. And that's just something we want to do to benefit our community, make sure that this tragedy doesn't happen to any other families out there.
That sounds amazing. Is that something they come in, get the ultrasound, they're going to get the results right then, or is there a follow-up appointment required? Just so people are aware when they come in.
Yeah, for the most part, we can get the results right then.
Okay.
There certainly will be times that we'll be extremely busy, especially if we get, the whole team of athletes decides to come in at the same time and get checked out. We'll get the results to them as quickly as we can. It's just at that point, it's just gonna be a matter of getting the athletes in. We'll try and schedule it on certain days so we can get as many athletes in and get them screened as quickly as possible. But our goal is to give them the results that day. And as long as they have a parent with them, there's no problem in doing that.
That's for any high school athlete, middle school athlete, college athlete.
Yeah, there's not a huge advantage to testing probably before about the 7th or 8th grade. It's really
Okay.
when people are starting to hit puberty is when the problem starts developing. So definitely high school athletes, definitely college athletes, um, and honestly anybody out there that's a heavy endurance kind of athlete should probably be getting checked for this. So even if you are a well-conditioned weekend warrior, again, this is another silent killer, and if you have it, there's treatments for it, and you want to get that done. The the key difference with this disease is it affects people that are really healthy. So the more healthy you get, the more that septum, that wall, that muscular wall grows, and so it just becomes worse as you get healthier. So that's why this one is kind of hard to diagnose. If you look at an athlete, they look like they're in perfect shape, and then they just drop over. So the only way you'd know about it is with the ultrasound.
Awesome. That's great to hear that there's people out there offering services like that for kids that we hear all the time on a hot day if a football player collapsed or
Yeah,
somebody fell over on a basketball court and they say from a heart condition and they don't really tell us what it is or that it's even preventable. It's
yeah.
just kind of like, oh, it's what happens. So it's great to hear that there is options for the athletes out there. And I personally appreciate you offering that to the community. Is there anything inside a Health Guardian we didn't talk about you think the public should know about?
Yeah, I wanted to talk about colon cancer screening.
Okay.
Colon cancer is a disease that develops over time. It usually starts as a polyp in your colon. So it doesn't usually develop as a mass. It really is a little tiny small polyp. And so that's what we're looking for in the colon. And so if we think about this like we did cervical cancer, so people used to die of cervical cancer all the time until we realized that it was a virus that was causing the cervical cancer. So women were getting the pap smears and they're looking for atypical cells that were really small and hadn't become cancer yet. And so by doing that pap smear, we were able to find the cancer before it became cancer and treat the patient. The other thing we found out is if we gave them the vaccine, so the HPV vaccine also prevents cancer. So in our population, if patients have access to pap smears and vaccinations, we hardly ever see cervical cancer anymore. It's occasional, but it's really happening in people that didn't have access to preventative care. Colon cancer is a very similar pathway there, and that colon cancer starts with a small polyp in your colon, and it can be identified. Well, we all get the colonoscopy. The colonoscopy is a fairly invasive procedure. You have to get cleaned out, you have to get sedated, you have to take the day off from work to go get it done, and they put a scope in your rectum and they look at your colon. That's all fine. Um, and it will identify the polyps. They can do the biopsy while they're in there, and that is, there's some advantage to having that done. Currently, we don't recommend even starting that until you're about 50, and then after you have your first one, they recommend about every 5 to 10 years to have another colonoscopy. Well, most patients obviously are going to choose to have it every 10 years. No one's going to proactively say, oh, gosh, I'd love to have another colonoscopy this year. And so we don't see that. And in radiology, we can do something called a CT colonography. And so we do a CAT scan of your abdomen, and we're able to reconstruct the images so it looks just like the colonoscopy. So you can actually kind of sort of fly through the colon and look at all the surfaces of the colon and identify the polyps. And so that's really what we're trying to do here, is identify polyps. Now, if we look at a polyp, we know that it's going to potentially become a cancer from the time it's a little tiny polyp to when it becomes a cancer. Now, how long does it take to get there? Well, everyone's a little bit different, but I can tell you it's less than 10 years. So you got that colonoscopy and you think you're safe, and you wait 10 years and you show up for that 10-year exam and you have colon cancer. Well, it's because the duration in between there is too long. And so we can't let patients go 10 years without screening them. And so that's the whole problem with the colonoscopy, because patients, who wants to have a colonoscopy every couple of years? No one. But if you do the CT colonography, and if you do it, say, every 3 years, it's a low dose radiation test, but you get it done every 3 years. And then if you see a polyp, that's the patient that should be going on to get the colonoscopy so they can biopsy the polyp. But if you don't have a polyp, you're good. You come back in 3 years. And then if we see a polyp on that one, we send you to get the colonoscopy and you get it biopsied. If there's no polyp, you're good to go, because a polyp is not going to typically grow from polyp stage to colon cancer in 3 years, but it certainly can in 10 years. And so using this test, we really could change the outcomes for colon cancer in general. Now, you may ask, well, why doesn't my insurance cover virtual colonography, but it does cover the CT colonoscopy? I'm sorry, the colonoscopy. And then, unfortunately, it all comes down to money. It would be a lot more expensive to do a colonoscopy on every patient than it would be to do a CT colonography. So they would rather wait. People develop cancer. We'll treat those cancers rather than screening the entire population. So for them, it's always cheaper to treat a few cancers than to screen the entire population. And that's where the whole problem is at. And so that's why health insurances don't agree to pay for CT colonography. That's why people don't recommend it. When you're in the medical community, if you have a choice between a CT colonography or a colonoscopy, I can guarantee you that every single physician will choose the CT colonography. And it's because they know it's just as good at looking for colon cancer, but it's not near as invasive. And so that's one of the things that we offer at Health Guardian Imaging, is we can do the CT colonography, which is a lot less invasive test. We can look for the colon cancer. We can look for it and find it when it's a polyp, and now it's treatable. It hasn't gone to your liver, hasn't gone all over your body.
Probably a lot less awkward for the patient as well.
Yes, definitely.
Outside of that, is there an additional cost? You mentioned the CT earlier cost $400. Is there an additional cost for that colonography?
Yeah, the CT colonography is a little bit more expensive, just because it's not as simple as just putting the patient on the table and scanning. We have to, we inflate the colon a little bit with air, so we can get good images, and we take a good pass through it. We reconstruct everything with a virtual software. Okay. So it's about $650 for the colonography.
Okay, that's not too much more expensive. You mentioned insurance and they don't cover that. Is all the prices at Health Guardian cash prices, or can somebody come in with insurance?
Sure. If they have insurance, we just bill the insurance as you normally would. if your insurance covers it, that's great. Most insurances don't cover screening exams. They only
Right.
cover the diagnostic exams. So again, if your doctor orders the exam, then it falls under diagnostic and your health insurance will cover it. If we're screening for an aneurysm in your abdominal aorta, Medicare pays for it once. And then after that, you're on your own. And so, um, for that reason, we have a set plan that's individualized for different people of different ages so that we can tell them, hey, this is what we really recommend you getting. You know, at this stage of your life, these are the tests you probably should get to screen for these different diseases. There's no point in doing an aorta ultrasound in a 10-year-old, for instance, but in a 40-year-old that has a smoking history, there's definitely some advantages to doing that. And even the, I talked about the CT colonography, and they talk about starting to screen for it at age 50, but we know that there's definitely people that develop colon cancer in their 40s. So they're essentially sacrificing, thousands of people every year that they know are going to get colon cancer before they even get to 50. And so we're really trying to prevent that.
So affordable pricing, but we can use insurance if we need it.
Absolutely. Yeah.
I appreciate everything you said, and I understand we got to get the orders, we got to go through our primary care providers, everything's affordable. What if I don't have insurance and I can't afford the $600? Is there any other options I can do to get maybe an MRI or something?
Yeah, we work with a company called Care Credit, which will, basically everybody qualifies for it. You come in, you get your imaging done, and Care Credit will essentially finance it for you. So then you just make a monthly payment to Care Credit. It's a pretty common way for most patients to get their health care taken care of currently that can't afford any out of pocket expenses at the time. That's a common way to do it, but we've tried to make our prices completely affordable. We talk about the CT for an example of $400 is what we charge for the CT. If you went to the hospital or a hospital-based imaging center, you'd be looking at about $3,500 probably to get that done. And so we're a fraction of the price. We try to make it as affordable as easy to access as possible. And then I think the Care Credit helps a lot with that. It really fills the gap.
That's amazing. So I really appreciate that. And same day appointments are available, next day results, really speeding up the process so people aren't waiting and kind of prioritizing the health of everybody in the community. Where can they find you at?
So we're located right off of Bradford Parkway. So easy to find us. We're pretty close to the so-called Medical Mile in Springfield, Missouri. Uh, Pretty easy to find. We're right behind kind of like the McAllisters, but off of Bradford Parkway, and we can get you in for same day appointments. We make it really easy for you to get in and see a clinician. If you need to see a clinician, we have very good and transparent prices, and we will get you the results as quickly as we can, usually the same day. If not the same day, definitely by the next day, we'll have the results for you. And again, if you want to go over the results with a radiologist, we can always do that for you as well.
Awesome. And the website is healthguardianimaging.com. If you've already got your order, you can go on there, get the phone number, call and book your appointment. If you don't have an order, you can check out healthhubclinic.com and book an appointment there to get an order if you need one and get you guys taken care of that way. We really hope you appreciate the information Dr. Maes is putting out there, and we look forward to getting more out there for everybody. If you have any questions, you can visit askdrmaes.com. That is AskDrmaes.com, and ask questions to be answered directly by Dr. Maes. I appreciate your time. Is there anything else you have for us?
I think that's great. I appreciate it, and we look forward to meeting again.
Yep, sounds great. Thank you so much.
Take care.